Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name, please? Nice to meet you, Mr. Zafar. May I know what brings you here today? Mm-hmm. Okay. Mm-hmm. Tell me more. I'm very sorry to hear about that, Mr. Zafar, and I understand that how difficult situation would be for you. But before I come to the management part, I'll need to ask you a few questions to better understand your condition. How it sounds to you, Mr. Zafar? Thanks for your cooperation, Mr. Zafar. So, can you tell me since when you are having a diarrhea? Mm-hmm. Okay, how many stools you are passing per day? Mm-hmm. May I know the color of a stool? Its consistency? Okay. Have you noticed that stool float in pan? Mm-hmm. Anything increase a stool? Anything decrease? Have you noticed any associated symptoms like vomiting, fever? Do you have a tummy pain? Have you noticed any weight loss? Mm-hmm. How about your urine output, Mr. Zafar? Is it adequate? May I know the color of your urine? Mm-hmm. All right. Okay, Mr. Zafar, have you noticed any blood in the stool? Mm-hmm. Do you feel thirsty? Have you noticed that your mouth is dry? Mm-hmm. Okay, Mr. Zafar, can you tell me how much urine you have passed in last 6 hours? Mm-hmm. Okay, if there is any weakness, you feel lethargic. Mm-hmm. Okay, if you feel any dizziness. Mm-hmm. If there is any headache, Mr. Zafar. Mm-hmm. All right. Do you pass lots of letters while opening balls? Mm-hmm. Okay. Mr. Zafar, if you had any barbecue meal. Mm-hmm. Okay. Any meal at a restaurant? All right. Is there any other family member suffering from some symptoms? All right. Mr. Zafar, if there is any past history of similar complaints? All right. Mr. Zafar, to better understand, I need to ask you a few personal questions. Is it okay with you? Thanks for your cooperation, Mr. Zafar. So, Mr. Zafar, do you smoke? How much cigarettes per day? Mm-hmm. And since how long you have been smoking? Have you ever tried to quit this habit? All right, I really appreciate it, and we'll talk in detail in next appointment. How it sounds to you, Mr. Zafar? Mm-hmm. All right, Mr. Zafar. Do you drink alcohol? Mm-hmm. And do you have high blood pressure, high blood sugar, any neck-related problem? Mm-hmm. All right, Mr. Zafar, if you are married, do you have children? I don't mind, but I have to ask Mr. Zafar, do you have any extramarital affairs? Mm-hmm. All right. If you traveled recently? Mm-hmm. Do you have itching along with that? All right, Mr. Zafar, have you noticed any change in your voice? What kind of weather you like the most? Mm-hmm. What do you do for a living? Mm-hmm. How's everything at workplace? At home? All right. Okay, so Mr. Zafar, have you noticed any joint pain? Mm-hmm. All right. If you are taking any medication prescribed by doctor or over the counter, do you have any allergies? Do you have any rash along with diarrhea? All right. Okay, Mr. Zafar, in order to reach my diagnosis, I need to examine you. Is it okay with you? Thanks for your cooperation, Mr. Zafar. Can you please come on the couch? And then I'll sanitize my hands and I'll start from general physical examination. And I'll start from his hands. I'll check if palms are dry or moisty, if there is any palmar erythema. I'll check the skin texture and nails, pulse, and then I'll check eyes for jaundice, anemia, any paleness, and any puffiness around the eyes, and I'll examine the neck for thyroid from front, and if there is any tenderness, any bulging, and then from behind, and I'll ask patient to swallow water, and then I'll examine the abdomen. Mr. Zafar, I'll be examining your abdomen, okay? And do you have any pain at any localized pain? All right. If you feel any pain, let me know. I'll stop there and then, okay? Then I'll inspect if there is any asymmetry, any bulging, any deformity, and the pattern of breathing. And then I'll palpate abdomen. If there is any organomegaly, and then I'll check for if there is any fluid trill positive, and then I'll percuss if there is any bloating. And then I'll check the signs of dehydration. I'll pinch the skin up and will observe if it goes back immediately or after a few seconds. And then I'll check actions for edema. Thanks for your cooperation, Mr. Zafar. You can have your seat. And then I will sanitize my hands. All right, Mr. Zafar, I'll offer a few investigations. Is it okay with you? But before I order, can you tell me if you have undergone an investigation so far? All right, Mr. Zafar. So here is urea create and electrolytes, okay? And stool culture, okay? And besides that, I'll offer you some non-pharmacological and pharmacological management. Okay, so the history you have shared and the examination I have performed, I came to the conclusion that most probably you are having a condition what we call in our medical terminology is, gastroenteritis. Okay, it could be due to a virus or bacteria. Okay, and these bugs cause inflammation of gut and causing watery diarrhea. Okay, and main symptoms of gastroenteritis are, watery diarrhea, vomiting, and generalized weakness. Okay, and there may be a decrease in output. Okay, and let me reassure you, Mr. Zafar, that it resolve over time. Okay, resolve with time. Okay, without a specific treatment. Okay, but but if you notice that your condition is worsening, then we're considering, adding medication, okay, like antibiotic, okay. But right now, I'm offering you some non-pharmacological, okay, and some pharmacological, okay. So I'll encourage you to allow your gut to settle by not eating for a few hours, okay. You can sip small amounts of clear liquids. Suck on ice cubes, okay, if vomiting is still a problem, okay, and then gradually reintroduce food starting from, easy to digest food like toast, broth, or apples, banana, and rice soup, okay, and I'll encourage you to avoid products like caffeine, okay. And besides that, Mr. Zafar, I'm offering you tablet Hasing for your tummy pain, okay, and keep yourself hydrated, okay? And your vomitings will be subsided, okay? But to be on safer side, prescribe me tablet metoclopramide, okay? You can take it, okay, for vomiting, okay? And as you stated that you have urgent meeting, and so for that, as your abdomen not distended, okay, and you don't have any flood test problem. So I'm prescribing you tablet lopramide capsule, okay, as a rescue therapy, okay. You can take it once per day, okay. And I'm offering you ORS, okay. Is everything clear till now? Yes, Mr. Jafar. And besides that, I'll advise you some preventive measures, okay, to be taken, okay, to avoid it to spread to your family members, okay, as the prevention is the only way to avoid viral gastroenteritis, okay, as there is no vaccine available, okay. And I'll encourage you, do not eat foods or drink liquids that might be contaminated, okay, canned foods, okay. And I'll encourage you to washing your hands thoroughly before eating, okay. Try to wash your hands thoroughly after using the washroom or changing diapers, okay. Try to wash your hands before and after meal, okay. Try to use fruits and vegetables washing properly after washing properly, okay. And prompt consumption of food, okay. How it sounds to you, Mr. Zafar? Is everything clear till now? All right, Mr. Zafar, here's a leaflet. It includes all the information regarding your condition. I hope it will be helpful for you. If there is anything else you want to discuss with me today. All right, Mr. Zafar. So I'll be seeing you after 1 week, okay. But if you notice any abdominal distension, fever, and your diarrhea is not subsiding, okay, then you can get immediate advice, okay. You can contact me anytime, okay. Is everything clear? Okay, Mr. Zafar, I wish you healthy and speedy recovery, healthy life and speedy recovery, okay. Take care of yourself. Bye-bye.